Welcome back to the Deep Dive. Today, we're cracking open a topic that honestly affects all of us. How to make sure your voice doesn't get lost in the often complex healthcare maze. And crucially, how to make sure it's actually heard and recorded.
Yeah, it's a fundamental part, really, of navigating the system. And it's one of those things that's maybe easy to overlook until you find yourself in a spot where it's absolutely critical.
Exactly. So we've been digging through quite a stack of sources for this one, looking at materials on healthcare quality, the work of accreditation bodies like Joint Commission International, JCI.
Right, and NABH in India.
NABH, yes, and how consultancy services kind of help hospitals meet these benchmarks. But the real sort of catalyst for this deep dive, it came from a guide on healthcare lifelines and documentation that just hammered home a point that felt, well, surprisingly profound.
Yeah. So the mission today really is to equip you with the understanding of why. Why documenting your healthcare journey isn't just, helpful advice, but often an essential defense. And what the serious consequences can be when you don't make sure your interactions are recorded, either by you or by the system itself.
Okay, let's unpack this then. Because the why here feels more urgent than maybe people think.
Yeah.
What is the real peril of undocumented interactions in healthcare?
Well, let's be honest, working into a doctor's office or hospital is often incredibly stressful for you.
Mm-hmm.
And healthcare situations themselves, they're just inherently emotionally charged. This environment, unfortunately, it's fertile ground for disagreements or misunderstandings.
Right.
With providers, with staff, whether it's the doctor, a nurse, or even, administrative staff at the front desk.
And one guide we looked at really called this out as a major pitfall, like arguing or trying to make crucial healthcare decisions without proper documentation.
Yeah.
It literally called it a recipe for frustration.
That's exactly right. Think about it. You have a disagreement. Maybe it's about a procedure you thought was agreed upon, or perhaps a diagnosis you're questioning, or even a billing error you spotted. Without documentation, it quickly devolves into a he said, she said kind of thing. Details get fuzzy, memories fail, and that's on both sides.
Right, because verbal communication alone, it's necessary, obviously, but it's just too unreliable for critical details, especially in a system where precision matters so much, relying just on memory. That seems like a setup for misremembering dosages or appointment times or even key bits of advice.
And here's a crucial, perhaps even surprising point. Undocumented arguments like, say, a heated discussion in a hallway or maybe an informal complaint you make to a nurse, they often don't change anything officially. Decisions in healthcare, they're based on the official record, your chart. If your concern or a specific request you made or even an agreement about your care isn't logged formally
in the system,
in your chart or the system, it effectively didn't happen. It won't influence future actions or decisions.
Wow, okay. So it's not just about remembering things correctly, it's that the system itself needs that written record to even acknowledge your point.
Exactly. So going into any dispute or trying to challenge a decision without that paper trail, it significantly weakens your position because you just lack the formal evidence the system operates on.
And it's not just about disputes. Our sources mentioned other tangible risks beyond just arguments.
Oh, absolutely. There are significant financial and even legal risks. How many times have you heard someone say they were given a verbal assurance?
Oh, that's right.
Oh, yes, your insurance will definitely cover that. Or maybe a hospital administrator saying, look, don't worry about that particular bill. We'll work something out. If you don't get that in writing, well, it can absolutely lead to denied claims or surprise bills popping up months down the line.
That's a huge one. Or signing consent forms. They often have those vague terms like agreeing that additional services may be required.
Ambiguous.
Right. If you don't clarify what those might be and get it noted somehow, you're potentially opening the door to unexpected charges you definitely didn't verbally agree to.
And failing to document these things, it can really disrupt the continuity of care. Because the next provider looks at your chart and they see no history of your specific concerns or those agreements you thought you had.
Right.
It creates legal ambiguity because there's just no formal record of certain discussions. It quite literally leaves no trace of patient or caregiver concerns within the official system.
Which then, I imagine, makes future communication and cooperation much harder because that history just isn't there for anyone to refer back to.
Precisely. And, in the moment, Informal or undocumented disputes can actually cause staff to become defensive.
Yeah, I can see that.
Or in the incredibly busy environment of a hospital, they can actually distract teams, potentially even delay urgent care because, established protocols get disrupted by an informal argument that isn't following any clear channel.
And another point raised in the sources, missing deadlines. Like for submitting documents related to claims or maybe follow-up requests. If you miss those because you didn't document or track the requirements, it makes it incredibly difficult, maybe impossible, to argue your case later. Healthcare systems run on timelines.
They do, and missing them leaves you with very little recourse. So the stark reality, the sort of nugget here, is that in healthcare, relying solely on verbal information or informal methods, it's just fundamentally risky because the system's memory is the documented record, not verbal assurances or casual conversations.
Okay, that paints a really clear picture of the why. It creates this vulnerability where your experience might just become invisible to the system. So what's the actionable takeaway then? How do you ensure you do document status effectively? What do you do?
Right. Documentation is your countermeasure here. It creates that essential paper trail, something concrete, something that can be escalated, tracked within the system, and actually acted upon because it exists in a format the system understands.
One guide was very direct about this. Keep a record of all interactions. That means saving written communication, keeping receipts, getting copies of medical notes and discharge papers.
All of it.
And documenting any advice given. If you find yourself in a disagreement, say about treatment or bills, having that written advice or proof of previous communication is what instantly makes your argument credible to the provider, to the insurer.
And specifically for disputing charges, never do it without demanding and reviewing a detailed, itemized bill first. You absolutely need to see exactly what you're being charged for.
Okay.
This gives you a strong foundation. And honestly, it helps staff or insurance verify specific charges much more efficiently. You'd be surprised how often errors get uncovered quickly that way.
Right. And for those really important conversations, like about treatment plans or big decisions, agreeing to a procedure or maybe an alternative therapy, request written confirmation. If you can't get that immediately, maybe send an email summarizing exactly what was discussed and agreed upon. Send it to the provider or their office. That email serves as your own documentation timestamp, right?
Absolutely. Or just ask for a written referral or treatment plan that outlines precisely what was agreed. It gives both you and the provider a crucial shared reference point. Helps avoid confusion down the line.
And what about specific instructions, like medication details, dosages, schedules, or follow-up care info?
Always ask for a written note. Or, like you suggested before, carry a small notebook. Write it down yourself, note who told you when, what exactly was said. If you're unsure about something that was said, don't hesitate. Ask your doctor or nurse to repeat it and provide it in writing. It might feel a bit demanding.
Yeah, it might feel awkward.
It might feel awkward, but it's really for your own safety. Things like dosages, post-surgery care instructions, you need those right.
Absolutely. And after any visit or procedure, always ask for a summary recommendations, or a follow-up care plan in writing. Getting details about when to follow up, what specific tests are needed, getting that written down saves immense confusion later.
And beyond your own notes, use the formal hospital systems for raising concerns. This means asking specifically for a grievance redressal form that's often the official channel for complaints.
Okay, what grievance form?
Or emailing the medical superintendent or the patient relations office. And when you do that, be meticulous with the details. Include the time, date, the staff involved, and a clear factual description of the issue. Keep it objective.
And if you're unsatisfied with a decision or maybe someone's behavior, the advice is to request a formal meeting rather than, confronting someone informally in the hallway.
Right. A confrontation rarely helps. Ask for a case review, maybe a second opinion. You actually have a right to ask for a documented explanation for a significant step that was taken in your care or billing.
That's good to know.
And bringing a trusted relative or even a third-party patient advocate can be hugely helpful. They can help ensure clarity, make sure discussions and outcomes get documented properly.
And personal organization sounds key here, too. Maintain some kind of personal communication diary. Log medical updates, decisions made, names of consulting doctors and nurses, any concerns you raised, along with the date and time.
Yes, that helps ensure consistency. It helps you recall events if your care gets transferred, which happens, and it makes any formal communication or compiling a complaint much, much easier later on.
Okay, what about the financial and legal side specifically?
Meticulously record key conversations there too, especially with insurers or providers. Note down names of people you spoke to, dates, and precisely what was said and agreed upon. But a word of caution here, recording phone calls.
Ah, yes.
Be aware that while it might be legal in some places, you absolutely must check the specific consent laws in your state or country first. It's illegal in many jurisdictions without notifying the other party, so tread carefully there.
Very important point. Don't be afraid, though, to use written amendments on forms before you sign them. If a clause seems problematic like that one about agreeing to pay all charges unconditionally, even disputed ones.
Which you should never agree to.
Right. Cross it out. Write in your terms, like agreeing only to pre-authorized services. Initial and date your changes and try to get the hospital representative to initial them too.
Yes. And demand estimates and pre-authorizations. One source highlighted that uninsured patients in the U.S. actually have a legal right to a good faith estimate. That's a detailed estimate of expected costs before you receive care.
Beforehand, okay.
And insured patients should always, always get a prior authorization number for costly procedures. That's basically confirmation from your insurer that they approve and will pay for the service before it happens. Get that number and the confirmation in writing.
And here's maybe the simplest but most critical piece of advice. Just save everything.
Everything.
Every scrap of paper, every email related to your care, your explanations of benefits, EOBs from the insurer, bills, consent forms, even relevant text messages if communication happened that way. Just create a dedicated folder, physical or digital, whatever works for you.
And if you do find an error on a bill or in your records, dispute it in writing. Ideally, as one source suggested, via certified letter.
Why certified?
Because sending it certified gives you legal proof that the hospital or the insurer actually received your communication on a specific date. It removes any ambiguity about whether they got it. And always include copies of your evidence.
So the bottom line advice from one source, it was pretty stark but necessary. Read everything before signing. Always ask for proof of what was agreed or stated. And maybe most importantly, assume verbal promises are essentially worthless unless they are followed up by documentation.
Harsh, but often true in this context.
Yeah.
And let's quickly touch on what not to do based on the sources.
Okay.
Don't argue in hallways or near other patients. It violates privacy, obviously, and can be incredibly disruptive and stressful for others receiving care. Don't threaten staff, and don't record them without checking consent laws first. That can have legal consequences. But just as importantly, it completely breaks down any potential for trust and cooperation.
Yeah, it poisons the well.
Exactly. And echoing our earlier point, absolutely do not rely solely on verbal assurances for anything important. Get it documented.
And if you feel ignored or mistreated despite trying these steps, what's the next move?
Escalate responsibly. Ask for the hospital ombudsman or the administrator. Bringing in your insurer can also be particularly helpful, especially with those cashless care arrangements where the hospital bills the insurance company directly. They have leverage.
Right.
And third-party patient advocates, sometimes available through larger hospitals or nonprofit organizations, they can also serve as trained, neutral intermediaries to help you navigate the system and ensure your concerns are heard and documented through the proper channels.
So this really comprehensive approach, it helps ensure your voice isn't just heard in the moment, but critically, it gets recorded within the formal system where the decisions actually get made. It sounds like this focus on documentation by the patient connects directly to how healthcare systems themselves are trying to improve quality and safety. Is that right?
It absolutely does, and this is where it gets really interesting, I think. This push for clear, reliable records from your side. It fits directly within the broader context of healthcare quality and patient safety initiatives. You know, organizations like Joint Commission International, JCI, globally, and NABH in India.
Those accreditation bodies we mentioned.
Exactly. They exist precisely to set up and operate these rigorous accreditation programs for healthcare facilities.
So they're like external auditors kind of checking if hospitals are actually following best practices, including how they handle patient information, communication, and concerns.
That's a good way to put it. These standards they set often include things like international patient safety goals, which are specifically designed to address known problem areas in patient care areas where errors or miscommunication are unfortunately common. The whole accreditation process essentially compels health organizations to measure their performance, assess where they're falling short against these standards, and then, crucially, implement improvements.
And hospitals pursue this. Why? What's in it for them?
Oh, there are real benefits. Improved teamwork internally, gaining a competitive advantage, certainly increasing community confidence.
Yeah, that makes sense.
Better risk management, and fostering a stronger culture of patient safety throughout the organization. There are even entire consultancy firms that specialize in helping hospitals achieve these standards, covering everything from, internal process redesign to documentation systems.
So ideally, a healthcare system that's genuinely focused on achieving these quality and safety standards should inherently have crystal clear documentation practices built right into its processes, right?
Yeah.
Designed to protect both the patient and the provider. They should be capturing this information reliably.
Ideally, yes, that's the goal. However, and this is really the key takeaway from our sources, while the system strives for this, often through things like accreditation and consultants, successfully navigating it still requires you, the patient or caregiver, to be proactive. Proactive in ensuring things are documented from your side.
Ah, okay. So the system's efforts don't remove your responsibility.
Not entirely. In fact, your meticulous personal records can sometimes become a sort of de facto audit trail. Sometimes, honestly, they might be the only thing that highlights a discrepancy or helps hold a facility accountable to the very standards they claim to meet. It gives you a surprising bit of leverage. Documentation isn't just about protecting yourself from disputes. It's also about adding your data point, your experience, to the system's complex picture. And that can potentially reveal areas where their own internal documentation or processes maybe failed to capture your reality accurately.
Wow, so your personal notes could actually indirectly help the system identify gaps in meeting its own accreditation standards. That's a powerful connection I hadn't considered.
It really is. Ultimately, documentation empowers you. It is your best defense in a complex system that's fundamentally built on records. It helps you tackle challenges, resolve issues more effectively, and ensures smoother, more accurate communication throughout your entire healthcare journey.
Right.
It makes your concerns visible to the system in the format it understands, and it provides that concrete evidence for your claims when needed. And, as we just discussed, it might even help improve the system for others down the line.
So pulling this all together, what does this really mean for you, for the listener, as you navigate your own healthcare?
Well, I think it means that in a world where healthcare decisions are truly shaped by what gets written down, by what enters the official system, your voice matters immensely. But how you use that voice, and maybe more importantly, how you ensure it leaves a verifiable trace, matters even more.
Yeah. Documentation isn't just, annoying paperwork or bureaucratic hassle. This deep dive has really shown us it's a profoundly practical tool for your protection, for ensuring continuity of care, and for effective communication within this complex, often standards-driven system.
Exactly. It helps you stay organized, it keeps you informed, and it prepares you for potential challenges, bumps in the road. And all of that ultimately contributes to better health outcomes and hopefully a smoother experience overall. Whether you're just clarifying treatment details or disputing charges or simply addressing a concern you have, documentation is absolutely essential.
So here's maybe a final thought to leave with everyone. In this complex system that is striving, at least on paper, for quality standards, and one that relies so heavily on documentation, how can patients and providers maybe better collaborate? How can we work together to ensure the critical information isn't just communicated verbally, but is reliably documented for the benefit of safe, effective, and truly patient-centered care for everyone?
It really is a two-way street, isn't it? Needs attention from both sides of the interaction. Something to think about next time you're interacting with the healthcare system.
Absolutely.
Yeah.
Thanks for joining us for this deep dive.